If you're over 60 and have been told your blood sugar is running high, I need you to stop everything you're doing right now and pay very close attention. Because what I'm about to share with you could mean the difference between catching a serious problem early and finding out about it when the damage is already done. I've been practicing medicine for over 2 decades now, and I can tell you that some of the most heartbreaking cases I've seen in my clinic involve patients who had elevated blood sugar for years, but were only given one simple test. They thought everything was under control. Their doctors thought everything was under control. And then, seemingly out of nowhere, they were dealing with kidney problems, nerve damage, or worse. My name is Dr. Emily Hartwell, and I specialize in internal medicine with a particular focus on metabolic health in adults over 60. Over the years, I've helped thousands of patients navigate the confusing world of blood sugar management, and I've learned that the standard approach simply isn't enough for many people. Today, I want to walk you through 3 critical tests that every person over 60 with elevated blood sugar should be asking their doctor about. Before we dive in, if you haven't subscribed to this channel yet, I really encourage you to hit that subscribe button and tap the notification bell so you never miss another health tip made especially for you. And if you find this video helpful, please leave your questions and suggestions for future topics in the comments below. I read every single one, and it helps me create more content that truly serves people like you. Now, let me tell you about something that happened just a few months ago in my practice that really drove home why this topic is so important. I had a patient named Mr. Harold Jenkins, a 73-year-old retired postal worker from Austin, Texas. Harold had been checking his fasting glucose for nearly 8 years. His numbers were always borderline, hovering around that 110 to 120 range. His previous doctor told him to watch his diet, get some exercise, and come back in 6 months. And Harold did exactly that. He was a compliant patient, a good man who trusted the medical system. When Harold came to see me for the first time, it was because he'd been experiencing some tingling in his feet. Nothing major, he said, just a little numbness when he first woke up in the morning. He almost didn't mention it because he figured it was just part of getting older. That simple comment changed everything. When I ran additional tests beyond his standard fasting glucose, we discovered that Harold's blood sugar had been spiking dramatically after meals for years, reaching levels that were causing nerve damage without ever showing up on his routine morning blood work. This is exactly why I'm so passionate about educating people on the limitations of standard testing. The fasting glucose test, while useful, only captures a single moment in time. It's like trying to understand a movie by looking at one frame. You might get lucky and see something important, but you're probably missing the real story. Let me explain the first test that I believe is absolutely essential, and that's the hemoglobin A1C test. Now, some of you may have heard of this, and your doctor might even check it occasionally. But I want you to understand why it's so fundamentally different from checking your fasting blood sugar, and why it can reveal problems that would otherwise stay hidden for years. Your hemoglobin A1C, sometimes just called A1C for short, measures the average amount of sugar that has attached to your red blood cells over the past 2 to 3 months. Think of it this way. If your blood sugar spikes after every meal and then comes back down by morning, your fasting glucose might look perfectly fine. But all those spikes leave a trail. Sugar molecules attach to your hemoglobin, and they stay attached for the life of that red blood cell, which is about 3 months. The A1C test counts those sugar-coated cells and gives us a percentage that reflects your true average blood sugar exposure. I remember a patient named Mrs. Dorothy Chen, an 81-year-old former librarian from San Francisco. Dorothy was meticulous about everything in her life, including her health. She checked her fasting blood sugar religiously every morning, and her numbers were always in the low 90s. She came to me feeling proud of how well she was managing her health. But when I checked her A1C, it came back at 7.2%, which is firmly in the diabetic range. Dorothy was devastated. She couldn't understand how this was possible when her morning numbers were so good. The answer was in her evening routine. Dorothy loved to read, and while she read, she would have a small dish of dried fruit, some crackers, maybe a few cookies with her tea. These evening snacks were sending her blood sugar soaring for hours, but by morning, everything had settled back down. Her fasting test was catching her blood sugar at its lowest point, completely missing the real picture. For people over 60, I recommend getting an A1C test at least twice a year if you have any concerns about blood sugar. The target for most adults is below 5.7% for normal, 5.7 to 6.4% for prediabetes, and 6.5% or higher indicates diabetes. But here's what many people don't realize. Even within the prediabetic range, damage can already be occurring, especially to small blood vessels in your eyes, kidneys, and nerves. That's why catching these trends early is so crucial. If you're still with me and finding this information valuable, I'd really appreciate if you could type a 1 in the comments below. It lets me know you're engaged, and honestly, it helps this video reach more people who might need to hear this information. Now, let me move on to the second test that I consider absolutely vital, particularly for anyone over 60. This one isn't ordered nearly as often as it should be, and it's called the Oral Glucose Tolerance Test, or sometimes you'll hear doctors call it the OGTT. This test is different from anything I've described so far because it actually challenges your body to see how well it handles sugar in real time. Here's how it works. You fast overnight, just like you would for a regular blood sugar test. Then, at the laboratory, you drink a very sweet solution containing 75 grams of glucose. After that, your blood is drawn at specific intervals, usually at the 1 hour and 2 hour marks, to see how quickly your body can clear that sugar from your bloodstream. Why is this so important for people over 60? Because as we age, our bodies often lose the ability to handle sugar efficiently, even when our fasting numbers still look acceptable. This condition is sometimes called impaired glucose tolerance, and it can exist for years before it progresses to full-blown diabetes. The tragedy is that this is exactly the stage where intervention is most effective, but we can't intervene if we don't know about it. Let me tell you about Mr. Robert Williams, a 68-year-old retired firefighter from Chicago. Robert was the picture of health in his younger years. He'd spent decades hauling equipment upstairs and rescuing people from burning buildings. Even in retirement, he stayed active, walking his golden retriever every morning and playing with his grandchildren on weekends. His fasting glucose was 98, which his doctor called excellent for a man his age. Robert came to see me because his wife had watched one of my previous videos and insisted he get a more thorough evaluation. I could tell Robert thought this was a waste of time, but he loved his wife and wanted to humor her. When we did the oral glucose tolerance test, Robert's 2-hour reading came back at 182. For context, anything over 140 at the 2-hour mark is considered impaired glucose tolerance, and over 200 indicates diabetes. Robert was shocked. He felt fine. He had no symptoms. But his body had lost the ability to efficiently process sugar, and if we hadn't caught this, he would have been well on his way to diabetes and all its complications within a few years. We immediately started Robert on a targeted intervention program. He adjusted his eating patterns, added some specific exercises that help with insulin sensitivity, and within 6 months, his repeat test showed a 2-hour reading of 128. He had reversed course, all because we caught the problem when it was still reversible. But if this has surprised you, wait until you hear about the third test, because this one might be the most overlooked of all, and it provides information that neither of the other tests can give us. The third essential test is called the fasting insulin level, and it measures not your blood sugar, but the actual hormone that regulates blood sugar. This is incredibly important because insulin problems often develop years before blood sugar problems become apparent. Here's how to think about it. Your pancreas produces insulin to help move sugar from your blood into your cells, where it can be used for energy. In a healthy system, a small amount of insulin does the job efficiently. But when your cells start becoming resistant to insulin, which is extremely common as we age, your pancreas has to produce more and more insulin to get the same result. For a while, this extra insulin keeps your blood sugar in check, so your glucose tests look normal. But your pancreas is working overtime, and eventually, it can't keep up anymore. That's when blood sugar finally starts to rise. But by then, you might have had insulin resistance for a decade or more. By measuring fasting insulin directly, we can catch this resistance pattern long before blood sugar becomes abnormal. It's like having an early warning system for metabolic problems. I'll never forget Mrs. Patricia Gonzalez, a 76-year-old retired schoolteacher from Phoenix. Patricia had been the picture of health her whole life. She ate well, stayed active, and her fasting blood sugar was always around 95, which her previous doctors had praised. But Patricia was gaining weight around her midsection despite eating less than she ever had, and she felt exhausted no matter how much she slept. When I checked Patricia's fasting insulin, it came back at 28 microunits per milliliter. For reference, optimal fasting insulin is typically below 7, and anything above 12 starts raising red flags. Patricia's pancreas was working 4 times harder than it should have been just to keep her blood sugar normal. She had severe insulin resistance that would have eventually overwhelmed her system. We made some targeted changes to Patricia's lifestyle, focusing on meal timing and specific types of movement that improve insulin sensitivity. We also addressed her sleep quality, which turned out to be much worse than she'd realized. Over the course of a year, her fasting insulin dropped to 11, she lost the stubborn weight around her middle, and her energy returned. More importantly, we likely prevented her from developing type 2 diabetes and all the complications that come with it. Now, I want to address something important here. You might be wondering why these tests aren't standard practice if they're so valuable. The truth is that our healthcare system tends to focus on disease treatment rather than disease prevention. The standard fasting glucose test is cheap, quick, and it does catch people who already have significantly elevated blood sugar. But it misses so many people who are on the path to problems but haven't gotten there yet. As you get older, your body's ability to regulate blood sugar naturally declines. This isn't a character flaw or a personal failing. It's simply part of human biology. The tissues in your body become less responsive to insulin, your pancreas may not produce as much insulin as it once did, and your liver might release more glucose between meals. All of these factors work together to gradually push blood sugar higher. The tragedy is that the complications of elevated blood sugar, things like nerve damage, kidney disease, vision problems, and increased risk of heart attacks and strokes, don't wait for an official diabetes diagnosis. They can begin developing in the pre-diabetic phase, sometimes even earlier. Every year that goes by with undetected blood sugar problems is a year of silent damage accumulating in your body. Let me share one more story that really illustrates why comprehensive testing matters so much. Mr. Thomas Anderson was a 70-year-old retired accountant from Atlanta. Thomas was extremely health conscious. He'd been monitoring his fasting blood sugar at home for over a decade, and his numbers ranged from 100 to 108, which he considered acceptable for his age. He exercised regularly, ate a reasonable diet, and felt pretty good about his health. Thomas came to see me after experiencing some vision changes. His eye doctor had found early signs of retinopathy, the kind of blood vessel damage in the eyes that's associated with diabetes. But Thomas was confused because he didn't have diabetes. His fasting sugar had never crossed that magical 126 threshold for a diabetes diagnosis. When we ran the complete panel, the picture became clear. Thomas's A1C was 6.3%, putting him in the pre-diabetic range. His oral glucose tolerance test showed a 2-hour reading of 172, and his fasting insulin was 19, indicating significant insulin resistance. Thomas had been accumulating damage for years, while his single-point fasting tests reassured him that everything was fine. The good news is that we caught this before Thomas had any serious vision loss. With aggressive lifestyle interventions and close monitoring, we were able to improve all of his numbers significantly over the following 18 months. His eye doctor confirmed that the early retinopathy had stabilized and wasn't progressing. But if Thomas had waited another few years relying only on his morning glucose checks, the outcome could have been very different. I want to take a moment to talk about what you can do with this information. First and foremost, I encourage you to have a conversation with your own doctor about these tests. Bring a list of questions. Ask specifically about A1C testing if you're not already getting it regularly. Ask about whether an oral glucose tolerance test might be appropriate for you. And discuss the possibility of checking your fasting insulin level to get a complete picture of your metabolic health. It's also important to understand that no single test tells the whole story. The power of these 3 tests together is that they each reveal different aspects of how your body handles blood sugar. The fasting glucose shows you a single morning snapshot. The A1C reveals your average exposure over months. The oral glucose tolerance test shows how your body responds to a sugar challenge. And the fasting insulin tells you how hard your pancreas is working behind the scenes. There are also some lifestyle factors that profoundly impact all of these measures. Regular physical activity, particularly the kind that builds muscle, dramatically improves your cell's sensitivity to insulin. The timing and composition of your meals matters too. Eating larger meals earlier in the day when your body processes sugar more efficiently can make a real difference. Quality sleep is crucial because poor sleep actually makes your cells more resistant to insulin. And stress management plays a role as well, since stress hormones directly impact blood sugar regulation. If you're finding value in this information, please consider sharing this video with someone you love who might benefit from hearing it. We often don't think to share health information with our family and friends, but something as simple as forwarding a video could genuinely change someone's life trajectory. Mrs. Eleanor Mitchell, a 79-year-old retired nurse from Boston, came to me last year because her daughter had sent her one of my videos. Eleanor had been a nurse for 40 years. She thought she knew everything about diabetes prevention, but she had never heard anyone explain these tests the way I had, and it made her curious. When we ran her complete panel, we found that her A1C was creeping up into the pre-diabetic range, even though her fasting glucose remained normal. Eleanor told me later that if her daughter hadn't shared that video, she would have continued on the same path and probably developed diabetes within a few years. Instead, she made changes that brought her A1C back into the normal range. That's the power of information. That's why I make these videos. And that's why your engagement, your comments, your shares, they all matter so much. Every person who learns about comprehensive blood sugar testing is someone who might avoid years of complications. I also want to be very clear about something. Nothing I've said today is meant to replace the advice of your personal physician. Every person's situation is unique. Some people may have reasons why certain tests aren't appropriate for them. Others may have additional risk factors that warrant even more extensive testing. The goal here is to empower you with knowledge so you can have informed conversations with your healthcare team. As I think about all the patients I've helped over the years, what strikes me most is how preventable so much suffering is. Mr. Samuel Wright, an 82-year-old retired jazz musician from New Orleans, told me something last year that I'll never forget. He said that knowledge was the best medicine he'd ever received. Samuel had spent 15 years slowly developing complications from undiagnosed blood sugar problems. By the time his fasting glucose finally crossed the diabetes threshold, he already had neuropathy in his feet that made it painful to stand at his piano. He told me that if he had known about these tests earlier, if someone had checked his A1C or done a glucose tolerance test, he might have caught this decades ago when it could have been reversed. Samuel's story stays with me because it represents so many others. People who did everything they were told, who trusted the system, who got their annual checkups, but who fell through the cracks because the standard testing wasn't comprehensive enough. I don't want that to happen to you. I don't want you to be sitting in a doctor's office in 5 or 10 years, learning about complications that could have been prevented. That's why I urge you to take this information seriously. Ask questions. Advocate for yourself. Get the tests that can reveal what simple fasting glucose alone cannot show. The body has an amazing capacity to heal and adapt when given the chance. I've seen patients in their 70s and 80s dramatically improve their metabolic health with the right interventions. But we can only intervene effectively when we know what we're dealing with. These 3 tests, the hemoglobin A1C, the oral glucose tolerance test, and the fasting insulin level together paint a complete picture that allows for truly informed decision-making. Your health is your most precious asset. As we get older, it becomes even more important to be proactive rather than reactive. The patients who do best in my practice aren't necessarily the ones who started with the best health. They're the ones who took charge of their health, who asked questions, who got complete information, and who made changes while those changes could still make a difference. I genuinely hope this information serves you well. If you have questions about anything we've discussed today, please leave them in the comments below. I read through them regularly, and the questions you ask often inspire future videos that help thousands of other people. If you haven't subscribed yet, now is a great time to join this community of people who are taking their health seriously. Remember, knowledge is power, but only when you act on it. Schedule that conversation with your doctor. Ask about these tests. Take the steps today that your future self will thank you for. Before I let you go, I want to share a few more practical insights that I've gathered from decades of clinical experience. These are the things I wish every patient knew before their next doctor's appointment. First, timing matters enormously when getting these tests done. For the fasting glucose and fasting insulin tests, you need to have genuinely fasted for at least 8 to 12 hours beforehand. Water is fine and actually encouraged, but no coffee, no tea, nothing with calories or artificial sweeteners. I've had patients whose results were skewed simply because they had a splash of cream in their morning coffee before the test, not realizing that even that small amount could impact the results. Mrs. Barbara Foster, a 74-year-old retired florist from Denver, learned this lesson the hard way. She had been getting her fasting glucose tested annually for years, always stopping at her favorite cafe on the way to the lab for what she called just a small skim latte. When I explained that this was affecting her results, we redid the test properly and discovered her true fasting glucose was 15 points higher than what had been recorded for years. All those previous tests had been giving her falsely reassuring numbers. For the oral glucose tolerance test, the preparation is even more important. In the days leading up to the test, you should be eating your normal diet and maintaining your usual activity level. Some people try to eat extra healthy in the days before, thinking they'll get better results. But this actually defeats the purpose. We want to see how your body handles sugar under your normal conditions, not under ideal conditions that you can't sustain long-term. I also want to address something that comes up frequently in my practice, which is the question of how often these tests should be repeated. For someone with normal results, I typically recommend rechecking the A1C annually. If the results show prediabetes or any concerning trends, more frequent monitoring becomes important, perhaps every 3 to 6 months. The oral glucose tolerance test doesn't need to be done as frequently unless there's a specific reason to track changes, but I do recommend it as a baseline test for anyone over 60 who has never had one. The fasting insulin is something I like to check at least once as a baseline, and then periodically if there are signs of insulin resistance, such as increasing weight around the midsection, skin tags, or darkening of the skin in the creases of the neck or armpits. These physical signs can alert us to metabolic changes that might warrant retesting. Another question I frequently encounter is about the accuracy of home glucose monitors versus laboratory tests. Home monitors are wonderful tools for daily management, but they have a margin of error that can be significant when we're making diagnostic decisions. Laboratory tests are more standardized and accurate, which is why major decisions about diagnosis and treatment should be based on laboratory values, not home readings alone. Mr. James Sullivan, a 66-year-old retired construction foreman from Philadelphia, came to me convinced that his home glucose meter was broken. His morning readings at home were consistently around 115, but when he got a laboratory fasting glucose, it came back at 94. The discrepancy confused him. In reality, both readings were within acceptable ranges of error for their respective methods, but it illustrates why we can't rely solely on one data source. Let me also mention something about the supplements and medications that can affect these tests. Certain supplements, including high-dose vitamin C and biotin, can interfere with some blood sugar measurements. If you're taking these, it's worth mentioning to your doctor before the tests are ordered. Some medications, including steroids, certain blood pressure medications, and some antidepressants, can also impact blood sugar levels. Your doctor needs to know everything you're taking to interpret the results correctly. Mrs. Virginia Palmer, a 71-year-old retired dental hygienist from Seattle, had been on a low-dose steroid for an autoimmune condition for years. When her blood sugar tests started showing elevated numbers, her previous doctor immediately assumed she was developing diabetes. But when we took a more nuanced approach and considered the impact of her steroid medication, we realized her underlying metabolic health was actually quite good. The elevated numbers were a medication effect, not a sign of metabolic disease. This changed her entire management plan and saved her from unnecessary additional medications. I should also emphasize that these tests are not just about diagnosing problems. They're about understanding your individual metabolic fingerprint. Everyone's body processes sugar differently. Some people can eat a bowl of rice and barely see their blood sugar rise, while others might experience a significant spike. Understanding your personal patterns allows for much more targeted and effective interventions. Mr. Richard Martinez, a 69-year-old retired chef from San Antonio, was particularly fascinated by this concept. As someone who had spent his life around food, he was curious about how different meals affected his body. After getting his baseline tests done, we worked together to understand his personal responses. He discovered that he could handle moderate amounts of whole grains quite well, but fruit juices, even those labeled as natural or healthy, sent his blood sugar soaring. This personalized knowledge allowed him to make changes that were sustainable because they were based on his body's actual responses, not just generic dietary advice. The beautiful thing about catching blood sugar issues early is that lifestyle interventions at this stage can be remarkably effective. We're not talking about perfection here. We're talking about sustainable changes that compound over time. Walking for 30 minutes after your largest meal can significantly blunt the blood sugar spike that follows. Choosing to eat your vegetables and protein before your carbohydrates in a meal can slow sugar absorption. Building and maintaining muscle mass as you age keeps your cells more responsive to insulin. Mrs. Helen Kowalski, an 80-year-old retired nurse's aide from Pittsburgh, was skeptical when I suggested resistance training as part of her blood sugar management plan. She had never lifted a weight in her life and wasn't sure she could start at her age. But she trusted me enough to try, starting with very light exercises and gradually building up. Within 4 months, her A1C had dropped by 0.5 percentage point without any other changes to her routine. She told me she wished she had started this 20 years earlier, but I reminded her that starting now was infinitely better than never starting at all. That's the message I want to leave you with today. It's never too late to gain knowledge about your health. It's never too late to ask for more comprehensive testing. And it's never too late to make changes that can shift your trajectory toward better outcomes. I've seen patients in their 80s turn their metabolic health around. I've seen people who thought they were destined for diabetes change course because they got the right information at the right time. You could be one of those people. Your future health depends largely on the decisions you make today. So please, take this information to heart. Talk to your doctor about the hemoglobin A1C, the oral glucose tolerance test, and the fasting insulin level. Don't settle for a single snapshot when you could have the whole picture. Your health is worth the extra effort. Thank you for spending this time with me. Take care of yourselves, and I'll see you in the next video.